can I just respond to that quick first?
Sure.
Please,
Yes,
please.
please.
I mean, first of all, you need to know that all of us in medicine have been confused on this too. And the fact that this is a, quote, novel coronavirus, meaning we haven't seen this before, means we have a lot of, many of the questions you ask and we ask, we can't answer yet. And hopefully with every day, week, and month, we're going to answer them better. And we will. But for example, there was some really, you had asked me about people getting this over again. And I first saw that and went, people don't get viruses a second time. We don't get the same bacteria again. In general, when you get over something, you're over it. Influenza's the exception. You're over it this year, but maybe not next. And but the bottom line is Korea, and I don't remember what the CDC of Korea is called, but they reported, depending on who you talk to, 51 or 90 some odd cases where people seem to get this over again. And that's virtually unheard of in medicine.
Really? Wow.
But they are the first to say, we don't really know what this means. And in spite of what we've all said about testing isn't nearly perfect. The false negative rate averages in the best tests about 30%. And the false positive rate in these new Abbott tests that are 15 minutes are 20%. So 20% of the people who test positive aren't really positive.
Dr. Barry, can you explain to the chat what the false positive is for those of us who don't know what that is? A false positive.
Okay, so false positive means you have a positive test, but you don't have COVID. A false negative is you do have COVID, and the test doesn't show it. And so our testing is imperfect. You guys have probably heard the jokes. One of the reasons we didn't have swabs is almost all the swabs in the world were made in northern Italy. And guess what? Northern Italy isn't working much better than Manhattan right now.
True. And that's a good point.
So there's been all kinds of problems with the international supply chain with this. But there are so many questions that we have as scientists, some of which we can answer. As a quick aside, we have tried COVID-19, or some lab has done a monkey model, and when they've had it and they develop antibodies to it, the antibodies are protective and the monkeys don't get infected again. It's theoretically possible, and Korea didn't report this. Imagine you have a really lousy immune system. Maybe this group of people didn't develop antibodies, and it's also possible they never really got over it in the first place,
I see.
as opposed to they got reinfected. So nobody knows what that means, but we still have more questions than answers, and it is confusing to us too. The one last thing though in New York, which you brought up with Dr. Cuomo, he may feel like this after this, okay? Because he's dealing with way more medicine than he wants to.
Right.
But if you want to think about cases and deaths being 14 to 21 days behind, that's really what even if we're seeing many fewer infections, the deaths are not going to drop for a few weeks.
That's true.
And it's that, yeah.
I get it. Yeah. That makes sense. I mean, it seems to be there's so many things that we just won't know until like after a few months, like about the coronavirus, and like just by the numbers itself. I'm just talking about the numbers, and it's
right. I mean, all of us are pretty sure we have at least 2 million cases in the U.S. or have had, and maybe 4, maybe higher.
Wow.
Oh, wow.
And that's because none of us have been able to test the people we've wanted to test just in the last week or so nationally. We're able to test almost everybody we need to test. But we were, simply the swabs weren't there, the transport media weren't there. And as a quick aside, that Bellingham purchased, like everybody, we purchased these super fast Abbott 15-minute tests, and we purchased the reagents, and frankly, FEMA took them all and sent them to New York, where I'm only laughing a little because New York needs them more than we do right now. Because I think I'm not trying to say that Washington is smarter than the rest of the country, but we had the first case that came through SeaTac Airport in Seattle, and it was just north of Seattle. And we basically started doing preventative things way before anybody else in the country did. And we really haven't seen a surge outside of Seattle Seattle was borderline manageable.
Wow.
The other communities in the state have been pretty manageable.
Yeah.
I see. So I have a question. I mean, again, this was another big confusion for me when the CDC announced few days ago, maybe just a week ago, like, okay, so now they do say you have to wear masks. But I remember like a month ago, I was hearing on NPR, like, doctors coming out saying, yeah, if you have the virus, you can try to prevent others from getting it if you wear a mask, but it doesn't really mean that you're not going to be getting it if somebody else has it, if they're not wearing a mask. So what is the deal with the masks? Is it actually, does it help? Does it work? I mean, we are wearing them, but what's the answer behind the masks?
So the bottom line is whether masks help or not depends on partly the wearer. And for example, if your mask itches and you start touching your mask and all over your face, it actually could increase your risk of getting something.
Right. The cross-contamination.
There's and that happens to a lot of people, and everybody just try not touching your face sometime. People have taken movies of people after they've been told not to touch their face, and they go, "Oh God, I really did that," But so the data is that if the big reason to wear masks is if you are an asymptomatic shedder of COVID-19, you will reduce exposure to other people.
I see.
Does it really protect you very much? Nope.
I see.
So basically,
but it does protect the community.
It
does
helping.
protect the person at the grocery stand,
I see.
who
might get it.
And the CDC weighed these recommendations for a while, but it isn't straightforward that masks are obviously not a panacea.
Right. It's more of a
so basically, So I mean, basically, the only way to actually get it is from respiratory fluid, right? Or contamination from someone who has it.
As far as we know, yes. And in some ways, the family data is reassuring, meaning even with household members, the Korean data is about 8% of household members get something, and in the U.S. it's about 11%. And you'd think it would be worse than that. And if you just look at contacts, like at work or something like that, it's about 0.5%.
Wow, interesting.
Wow.
Oh, wow.
That's a lot lower than I thought it would be. Yeah.
And it was low. Frankly, I looked up a couple of things for this, and it was lower than I thought it would be too.
Yeah. Well, we actually have we have a few questions already from the chat. Ben Schindler Violin asks, which news side would you recommend with little bias and fact-based information for us about the virus?
You know what? I don't know. And I've been getting news from all over the place. As an aside, historically, you'd see things written in a medical journal, and then the New York Times would report it. And now it's backwards. It's reported. The Korean things that I told you about came from Bloomberg and somebody else, and they'll probably get reported in a medical journal a month from now. But I don't know what the best places to look this up on.
I see.
I'm sorry.
I see.
I think just everywhere.
Yeah.
I'm getting information like you guys are from at least 50 different sources.
Right.
Yeah.
It's probably best to just try to have as much context as possible. That would probably,
Yeah.
Actually,
I have a question, Dr. Berry, that I've been thinking about. Was we have a lot of time to think these days about, and it's about the virus itself. So I remember learning in school, and when I was still taking science classes and stuff, that a virus, the whole point of a virus is not to kill the host, but just the virus wants the host to keep living, because that way, the virus survives. So obviously, you're talking about COVID's a new virus, and it seems like it doesn't have its stuff together to survive very well because it's killing off its host. So my question is that a thing where the virus eventually will mutate so that it actually will be less severe, where it won't kill as many people off?
Nobody knows, and we also don't know if this virus will or can mutate, and we don't. And that any good virologist would tell you that.
I see.
So you're right. In some ways, Ebola, especially when we had no treatment for Ebola, was the world's worst virus because it killed almost all the hosts, and so it would wipe out a village, and the epidemic would be gone.
Mm-hmm.
And that seemed to be what happened with Ebola and Marburg and some of those horrible GI viruses that killed so many people in Africa.
Mm-hmm.
Your best virus at least allows the host to be alive long enough to contaminate or infect a bunch of other people.
I see.
You're right.
I see.
But
yeah.
Some people argue actually viruses aren't even really alive. And so I don't think they're thinking about it.
That sounds scary.
Yeah. We have another question, actually from Siwoo Kim. There was speculation that the virus could be spread just through talking and breathing, not solely through droplets, sneezing or coughing. Is this confirmed?
No, it clearly is spread through singing. As an aside, singing may be worse than coughing.
What do you say about singers, Dr. Berry?
Hope we don't have any singers here.
I don't know. I guess I prefer, violins and violas. but I'm prejudiced. Anyway, but yeah, if you can imagine somebody's a runner or a cyclist and they're breathing hard and they're breathing out hard, would I at least worry that if that person breathed on you, that it's possible to contract it? The data in general, though, it's kind of like tuberculosis, which I don't expect you guys to be experts on, but in general, you don't get tuberculosis from walking through a room with somebody coughing with TB. You got to be in there for a while. Right. And the data seems to be that way with this, that you could even swab somebody's nose or something, and if you get in and out fast, you're very unlikely to be infected.
I see.
I see.
Interesting.
I have just another clarifying question about symptoms. I feel like, when this all came about, they were saying, okay, flu-like symptoms, coughing, so like shortness in your breath, and those are sort of the key things. But now I'm also hearing like, pink eye in both eyes, like getting a lot of like shivers. I guess that's sort of like a flu-like symptom. But I'm hearing all these other symptoms that can also be COVID. So what would you say are like the real, like if you have these symptoms, go get tested. Like what would they be exactly?
I think in today's world, 2 out of 3 of fever, cough, and shortness of breath. Any 2 or 3 of those right now, I'd get tested. And yes, we can get you tested now. And no, we couldn't a month ago because the testing wasn't there. But, so 99% of people have fever, and in general, the CDC rule of fever is above 100.4. Though you need to know they've been changing their mind on that at different times. 70% of people have fatigue, 60% have dry cough, 40% have anorexia, 35% myalgias, 31% shortness of breath, and GI is about 15. And things like conjunctivitis, like you brought up, absolutely occurs in this, but it does in every respiratory virus. Just plain old colds can give you bilateral conjunctivitis, and basically every respiratory illness can do that.
We have a question from Jeff Myers Violin. He's asking, does the TB vaccination protect against the virus, or is that false information?
They're looking at it.
I
mean, if you want to know what works for what, we can talk about that and what the data is. But is it possible? So just in terms of Jeff's good question, if you look in areas that have high endemic rates of tuberculosis, historically people have had a vaccination with something called BCG, which sort of geared up your immune system and was relatively protective, by no means perfectly, for tuberculosis. And so the question is, if you can gear up your immune system like that, would it protect you, maybe not from getting the virus, but from dying from the virus? And the answer is, it's not stupid to think that it would, but do we have good data? We don't.
Oh, I had the BCG because I grew up in Japan, and that requires, in order to go to school there, it requires to have BCG. But in the US health system, it's different, right? Because I had to get it scanned to make sure I don't have TB. So are people, if this was like a case, then are Americans more in danger of getting this? Or are they?
Is this Tanomi?
Yes.
Tomomi, yeah.
Okay, so your guess is as good as mine. I just figured because you said you grew up in Japan.
Yeah.
Maybe. I mean, if you look at the mortalities around the world, they varied markedly, but some of it is artifactual. Imagine if you look at Germany, almost all of the initially infected people were young, healthy skiers skiing in Italy and Switzerland.
Right.
And guess what? Their mortality is going to be unbelievably lower than a group of nursing home people.
Right.
So as soon as this goes batshit crazy in a nursing home, and many of the nursing home people might, not all of them, but many of them have a life expectancy of 3 months, 6 months, a year anyway.
Right.
And metaphorically, they're already teeter-tottering on the edge of the abyss. And you get if they had a severe influenza, they could easily die.
Right.
And this is worse than this. So some of the mortality figures relate to who gets infected. And in Germany, it was young, healthy people.
Yeah.
And in Korea, it seemed to be that religious group.
Right. Yeah, the cult group. Yes, it's Shincheonji. Yes, and in Seattle, it was really targeted at a nursing home, right?
We also we had a quick question before that I think is actually quite relevant to the music community. Is obviously we don't, as you were saying, Dr. Barry, that it's the data's coming in, so the possibility for vaccine also is going to move a little bit slow. So for us, we worry about when the concert hall is going to open, and that is basically a large gathering, and we know that's not going to happen probably until a vaccine's created, right? The government's not going to allow a concert to happen unless there's a vaccine, right? Am I mistaken, or?
Again, Henry, your guess is as good as mine.
Okay.
Where we're going to be a month from now. I mean, and we don't know if this is like influenza and it will largely go away or totally go away in the summer. We don't have evidence that it is so far. So this may not be cyclical like the Spanish flu was or like H1N1 was.
Yeah.
So, anybody, Tony Fauci, the guy that's the head of NIH, excuse me, I got the hiccups.
Oh, no worries.
Right.
Take your time.
So Tony Fauci has said the virus will determine, how we approach it, and I think that's the only way to look at it. Right. Would I love you guys to be playing again, and be able to see Kristen in Emerald City sometime in the fall? I would love that, but do I know when this is gonna, when we're all going to be up and running in music? I don't, and neither does anybody.
Right.
And I think the worst case scenario for a vaccine is still 18 months, and people are saying 12 to 18 months, but I think it could be faster than that. We've never put this much money into doing anything in medicine almost.
Wow, that's
we will have more medicines by then, and we will know which ones of these things work.
Right.
And
I guess all we can do at this point is to just stay home and take good care of ourselves. Siu asked about if you feel like you have the coronavirus, but it's not as critical, and so you're going to be staying home. What would you suggest for those people who are feeling a little bit sick, or just for preventive things?
Okay, so doctors have two hats, right? We have one hat of what's necessary for this person, and we have another hat for what's good for our communities and our states and our country. And I would love everybody to be tested who might even have this now, because I think it's really useful data for you in New York or for us in Washington State. Who really has this and maybe doesn't have severe disease, doesn't need to be in the hospital. But I think it's good for our society to know this. Mm-hmm. And the things in the paper when Trump was saying a month ago the tests are great and we can get them on anybody.
Yikes,
that has clearly not been the case until the last few days, literally.
Right.
Actually, I have a question about that. When Trump says things like that, does it make like your job as a health worker harder? Like that's when it's not true, obviously.
Sure it does. I mean, patients go, well, I saw on television with the president saying, well, I can get this, and you're telling me I can't?
Yeah.
What are you talking about? I mean, do we get that all the time? Sure. I mean, again, we have been able to test healthcare workers, and part of this is when we thought we'd have literally 30 times more ventilator patients than we usually do. And that was really what we thought we'd have in Bellingham and in most places. Imagine somebody just has a cold and they've got a little cough and fever. Frankly, if our staff is overwhelmed, I want those people with colds back to work. But if you've really got the coronavirus, I want you home.
Yeah.
So
right.
we're checking our healthcare people because one, we want the public to be safe from us, and two, I want the people who can work. Maybe they got a little residual cough and they're over their cold and they've got a mask on so they can't infect somebody else. And frankly, healthcare people have been pretty good the last 10 years for washing their hands, but we've found the Lord and we're really washing our hands now.
I know,
Well, one thing we know is just how grateful we are for all of the healthcare workers that are out there right now, just really putting their lives out there and trying to do everything to stop this and help save these lives. So we can't thank you enough for everything that you're doing. I mean, honestly, it's just, you're our true heroes right now. So thank you so much for everything that you're doing and also for joining us on this call. I think a lot of us really found it so informative, and just to have the opportunity to be able to talk to someone independently like this, I think it really helped a lot of us. So thank you so much, Dr. Berry, for being with us. Yeah.
Well, you're welcome. And I felt like a little bit less of an idiot when Henry couldn't solve my IT problem.
No, Dr. Berry, I don't know what Jeremy's telling me. I'm not that smart.
But let's give it.
He would beg to differ.
Oh,
well, big round of applause for Dr. Berry.
Thank you, Dr. Berry.
Thank you so much.
Good night, you guys.
Good night.
We'll talk to you soon.
Thank you so much.
Thank you so
wow,
much.
that was really, really, really helpful to hear and have a lot of clarification.
Amazing.
I mean, it's unfortunate that most of it, is that a lot of it is unknown. But I guess best we can do is to just keep following the rules here. Stay home, wash your hands, wear your masks, and keep your social distance. And
but also keep morale up that we're making progress.
Yeah.
I mean, well, not we, but the healthcare workers, the researchers, they're making progress. I mean, it's taken a while, like Dr. Berry is saying, because it's a new virus. Right. It's reacting in ways that we haven't seen.
Right.
I feel like I'm Trump. It's reacting in ways we haven't seen ever before.
Don't ever say that. That's awful. Not even as a joke.
Never ever like the best reacting. But anyways, but you know what I mean? Like it's but there is progress.
Yeah.
There is progress. So we can only hope. So
yeah.